everyone, I'm Dr Lynn Chiam from the Children Adult Skin Hair Laser Clinic, which is located in Mount Elizabeth, Novena Specialist Medical Center. I'm also the medical advisor to the Eczema Support Group of Singapore.
Thank you, Dr. Lynn, for talking with the Asian parent. A lot of our parent readers, they have kids with eczema. So we have a few questions compiled from our readers that we would like to ask you. If my eczema sores are open, should I cover them with a bandage or leave them exposed?
Well, I think first and foremost, it's very important to see a doctor if you have eczema with open sores, because open sores on eczemated skin allow entry of bacteria and viruses. So it's important that your doctor sees it and give you the correct treatment. After you've been treated for the infection with either creams or oral medication, then it will be advisable to cover the wounds, but only if it's been treated.
Can eczema lead to infections?
Well, of course. Like I mentioned earlier, people with eczema tend to have an impaired skin barrier function, which allow an easy entry for bacteria and viruses, and they are at higher risk than a person without eczema to develop skin infections.
How can you prevent eczema scarring? Because sometimes kids, they have a lot of eczemas on exposed areas like on the legs, below the legs, in the arms.
Right.
And when they grow up, you know, there's always this fear of scarring. So how would you prevent that?
Okay. Well, I think a lot of eczema scarring is due to scratching. When it's itchy, you scratch, it becomes more itchy, you scratch again. This is what we call the itch-scratch cycle. So it's very important to break the cycle. What I would recommend is, of course, get your eczema properly treated. Steroidal cream not only can decrease inflammation, it also decreases the itch. A well-moisturized skin is also less itchy compared to a dry skin. The other trick that I advise my patients to do is to wrap up their areas which they tend to scratch a lot. For example, it's like a cylindrical socks that they can wear over their limbs. And at night, if they tend to do a lot of scratching, to wear gloves, so that even if they scratch, the damage is less and it's minimized. Yeah, so less scratching means less scarring.
Does a pregnant mom with eczema need extra supplements?
Well, I don't think she needs extra supplements orally, but she do need to visit dermatologists more regularly because of the fact that during pregnancy there is a surge in our female hormones. So they are more likely to get skin conditions like eczema, and they have to be treated. And because you're pregnant, we try to use steroids which are milder than versus a non-pregnant patient.
Should I use steroid creams for itchy and swelling eczema?
Well, I think steroid creams do have a role in eczema, even if they are swelling, and especially when they're itchy, because like I mentioned, it reduces the inflammation, it reduces the swelling, and it reduces the itch. But of course, this has been used in combination with moisturizer as well as an antibiotic cream if needed.
What are the repercussions of prolonged steroidal use?
Okay. Well, steroids have different side effects according to whether they are oral steroids or whether they are cream steroids. So in dermatology, we use a lot of cream steroids, and the side effect of prolonged cream steroids usage will be skin thinning, easy bruising, and growth of unwanted hairs.
Okay. Is there any dietary advice for children with eczema, like what foods they can or cannot eat?
Okay. Well, I know a lot of parents are extremely concerned about whether food is the major trigger for eczema. Well, in my opinion, I think for children with eczema, it's best to let them have as much freedom as they want, food-wise, unless there has been a documented allergy to food substances. And to document this allergy, it would be best to see a dermatologist and to do a skin prick test.
Okay, one of the mothers says, my son has dry skin. Is it okay for him to go swimming? And what precautions to be taken before swimming if he has dry skin?
Okay. Well, it really depends on whether this dry skin is associated with eczema. When there's a flare of eczema, my advice is to stop swimming for the few days until it gets better. If you have dry skin and you want to go swimming, sure, you can, but just limit the duration of the swim. So I would say about half an hour, not more than an hour, and immediately after you get out of the swimming pool, please rinse off and apply loads of moisturizer.
Another mother asks, I understand that steroidal cream cannot be used for long term, but can I continue to apply moisturizer for my 7-month-old girl? If her eczema still shows, what alternative should I apply?
Okay. Well, I think steroids are important if they are red rashes, but if the rashes are resolved and you want to improve the skin barrier function, it's important for moisturizers to be used regularly long term. So the more moisturizer you use, the better your skin will become, the less flare of eczema. There are some steroid alternatives that are not moisturizers. They can decrease inflammation and they can decrease the itch. This new group of topical creams are called the topical calcium inhibitors. You can see a doctor and they will discuss with you whether it's suitable for your daughter.
One mum says, my 3-year-old boy has a stubborn wart on a section of his middle finger. Doctor gave me liquid solutions to apply to the specific area, then sand down and repeat. The stubborn wart refuses to go away completely. Any faster way?
Right. Okay, so warts can appear on any part of the body, but if they appear around the finger or near the nail, that would be a more resistant one because of the location. Apart from home applied creams, like you just mentioned, the other modalities of treatment will include liquid nitrogen. This will require the child to come to the doctor's office on a weekly basis, and we use liquid nitrogen at -196 degrees to freeze off the wart. The other faster method would be to use a ablative laser, for example, the mixed-dose laser that can laser away the warts, and that would be in one sitting.
One mum says, my 1-year-old has rough, itchy skin around her neck and scratches constantly. My 3-year-old has marks on her legs left by mosquito bites. What can I do for both?
Okay, so for the 1-year-old, it'd be good to see a doctor to establish whether there is a concomitant eczema, because if so, gentle steroids for a short period may be in order, together with regular use of moisturizer. For the 3-year-old with marks that's left behind by insect bite, these marks tend to improve in color as they get older, but if they tend to be persistent, there is a non-invasive laser called the Repercussions laser that can be used to treat these conditions. It is rather painless if numbing cream is applied just beforehand, and it can work quite well.
Final question from our reader. My 5-year-old daughter has a birthmark on her face, which is brown in color.
Yes.
How is it recommended that I remove it?
Okay. Well, birthmarks, if they are located in non-critical areas and they do not impede the bodily functions, may not need to be removed immediately. However, on the face, it may lead to some psychological distress as they get older, they get teased at. So for different birthmarks, there are different lasers that can remove them. For the brown pigmentation that you mentioned, again, we have the pigment laser that can slowly lighten the color after repeated sessions.
Thank you so much, Dr. Lynn, for your time talking with the Asian parent.
Okay.